Good morning and welcome to San Juan County's special Wednesday, June 24th meeting, which will be a council and a Board of Health special meeting. I'm now calling the meeting to order. Everyone please rise for the flag salute. Ingrid.
Yeah, thank you. Allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
And real quickly, I'd like to pay tribute to the Coastal Salish people. So first, let us acknowledge we reside on the ancestral lands and waters of the Coast Salish people who have taken care of these islands since time immemorial. Meeting is now called to order. At this point, we'll be taking public access or public comment through the Board of Health meeting. I will now recess the San Juan County Council meeting, and just for the record, the way this will work today for the public listening, Council will go into recess at 9:05. The Board of Health will call to order. We will have that meeting. If action is taken, then that meeting will recess, and the San Juan County will adjourn. And the San Juan County Council meeting will begin again, and then we will decide if there's any action to be taken, and then we'll be adjourned for the day. There are four email letters that I will read. The fifth, from a Liz Smith, is too long for the time we have today. It will be sent to each of the council members and Board of Health members and has been added to the public record, as well as the four that we will read. And then I will go through, based on Chair Heisinger's support of this, we'll go through the folks online who have are on the phone who have called in to see if there's public comment. I ask that each and every one of you please mute your lines when you come on. I will call your phone number in order. We just heard the entire conversation of someone, so please be respectful of people, and if you're watching the live stream, please mute it in the background. So Chair Heisinger, San Juan County Council's meeting is now in recess. The meeting is yours.
And thanks to everybody in attendance. I appreciate it.
Hold on, Dale, sorry. Sorry, Dale, I muted you. My apologies.
So welcome to the Board of Health meeting of June 24th, 2020. First on the agenda is approval of that agenda. People have had the opportunity to review it. Do I hear a motion to accept the agenda?
So moved.
Second. Those in favor say aye.
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 Bill.
Good. Thank you. We have two special meeting minutes that need to be approved. The first meeting was Friday, May 15th. I hope you've had the opportunity to read the minutes. Do I hear a motion to approve the minutes of May 15th, 2020?
So moved.
Second.
Bill. Could you repeat the second?
Bill seconded.
Bill seconded.
Okay. All in favor say aye.
Aye. Aye.
Opposed? The second minutes to be approved of the meeting of Friday, May 22nd. Do I hear a motion to approve those minutes?
So moved.
Seconded by Watson.
Those in favor say aye.
Aye.
Aye. Aye.
Opposed? The minutes have been approved. Thank you very much. Could we have a roll call of the Board of Health? John Guyman? John, are you here? Noel Monin?
Here.
Kyle Davies?
I am here.
And we heard you.
Okay, Bill Watson,
Yep, Bill Watson's here.
Jamie Stevens,
Here.
Rick Hughes.
Present.
John was on the phone earlier. Is he no longer on the phone?
He is on the phone. His line is muted.
Okay, thank you. So everyone is in attendance. We have some public comment. Rick, if you want to proceed with that, I would ask people, since one of the Board of Health members is leaving earlier, I'd ask people to keep their comments as short as possible so we can get on to the business of the Board of Health. Thank you.
All right, I'll make this as quick as possible. Christine Desmerick, public comment. I have concerns about moving to phase 3. With the recent spike in cases here in the mainland, it seems like you may be jumping the gun. I circulated a petition about the fireworks show. There were 300 people who signed and agreeing this is a bad idea. I heard many comments, and I was sent messages about people being afraid. People are talking about stocking up on food because they don't want to have to go to town when tourists have the island packed. I just want you to be aware that many islanders are afraid of this decision and the impacts it could have. Second one, Jane Searston. Dear council members, thank you for all you've been doing to protect us during this difficult time. I would like to add my voice to these who are concerned about moving to phase 3 of reopening when cases of coronavirus are increasing in the state of Washington. Please consider delaying your decision until the curves go down in King County and other locations where a majority of our summer visitors come from. Can you also clarify that if you decide to move to phase 3 and the cases in our island begin to climb, that you have the authority to move backwards into phase 2 and outline the steps you will take to do this? Third one, Susan Nichols. I'm opposed to phase 3 reopening while we have cases that have not been fully contact traced. Some islanders have been great about wearing masks, but most tourists have not worn them on the sidewalks and expect us to walk in the street if we want proper social distancing. The stores have had to put guards at the doors, and still people have tried to enter the grocery without a mask. Phase 3 would overrun our ferry system. It has been so hard for patients to see their physicians off island. Many specialties are only available off island. I had one couple tell me they got stranded in Anacortes. The ferries are reporting staff is out due to COVID. If we open up now, they will infect ferry workers, and then what? COVID doesn't just cause death. It can also cause lingering disability. Having worked with people with liver and kidney damage, I need to remind you that damage is no joke. Please listen to Dr. James. And the final email is from Justin Paulson. County Council and health officers, I'm writing in support of San Juan County Council and San Juan County health officers continue to make forward progress in our county moving through the state-mandated phasing system. San Juan County has proven to be a leader in maintaining the health and well-being of its citizens throughout this crisis. I support moving the county to phase 3 of the state process with the knowledge that at the county level we continue to provide protections that may exceed those provided in the state order. As part of this process, I would encourage the county council to suspend all county spending on tourism advertising and issue a joint letter encouraging the suspension of all advertising related to tourism within San Juan County. To the extent allowable, I would encourage all tourism advertising funds to be redirected to public education regarding health and safety protocols, as well as providing PPE and sanitizing materials to businesses within our community. While we will always be a tourist destination, now is not the time to promoting visitors regardless of our phase status. Thank you for your time and consideration and for your tireless work in keeping the community both physically and economically healthy. I'm now going to move, Dr. Heisinger, if that's all right, to the phone.
Yes, please do.
Okay, great. The first one I have is Abby Anderson. I will unmute you. And if you can keep your comments quick, that would be much appreciated.
Yeah, Abby Anderson, San Juan Island. Just here to listen. Thanks.
Great, thank you. I have someone, Andrews, Ed, I assume, 206-234-4148. Andrews, okay. Muting you. I have Anna Maria. Anna Maria.
Yes, thank you, Board of Health. Thank you, County Council. I just wanted to thank you and Dr. James for all that you've done to keep our community safe. And we look forward to your decision today to move us to phase 3 in a very safe way for our community and for our business community as well. So thank you again.
Thank you. Mr. Andrews, do you have a comment you'd like to make?
Yeah, can you hear me?
Yes.
Ed Andrews, Orcas Island. I was very happy to hear you read letters today. I was very disappointed to see you stop reading letters a few weeks ago when you got inundated with 30 letters. You are marginalizing voices in our community, and most of those voices tend to be working class people who can't afford to take off and have the freedom and flexibility to take off of their jobs to do that. And it marginalizes their voices, and I appreciate you reading those letters, and I hope you continue to do that in the future. Thank you.
Thank you. So the next one I have is guest. I don't know who it is. Is there someone who, it's an anonymous caller?
No comment.
Thank you. There's another anonymous caller. I'll mute you if you please could respond.
Listening.
Okay. Christopher Evans from Orcas.
My name is in there.
Hi there, Christopher Evans from Orcas Island. I do not support a advanced move into Phase 3. I am president of a business on Orcas Island that actually the more open for tourists that the island is, the more reluctant we are to be open. We're a business of massage therapy, and we're very much eager to start opening to serve the local community. But there's a wild card of tourists coming in from around the country in unknown parts. There's other states in the country that are actually putting a quarantine on travelers that are coming into their state for 2 weeks. And that's obviously not going to happen. Tourists are going to mingle within the community. So I want to proceed cautiously, especially as all of the Western states are now seeing a surge in the cases of coronaviruses. Thank you.
Thank you, Christopher. And just for everyone moving forward, and this is no reflection on Christopher, 2 minutes max for this, if that's possible. We have a lot of folks to get through. The next person I have listed is Sherry Daly. I will unmute you. Phone number 360-370-0073.
Yes, good morning. Can you hear us?
Yes.
We'd like to thank the Board of Health and the County Council for all the hard work that you're doing. We have a small restaurant in town that we have been experiencing we've been taking just dine-out service or carry-out service, and we will continue to do so. In respect to moving to Phase 3, we'll appreciate and abide by whatever the boards decide, but for us it'll have very little impact because we believe that the risk is too high to expose ourselves to dine-in seating for the health of our guests and for the health of our staff. So thank you very much for all the hard work you're doing. We'll all try to remain vigilant.
Great, thank you, sir. Just for clarity, when you say town, you mean Friday Harbor, correct?
I'm sorry, Friday Harbor, yeah.
Great, thank you very much. I have Lauren David, 360-350-3710. Okay, Eric Nelson.
Good morning, Eric Nelson from Snug Harbor Resort, San Juan Island, and like others, just thank the board and the council for your work. And we do support moving to Phase 3, and want to reiterate what was commented in yesterday's meeting about the 24-hour gap between rooms. We believe there's ample ability to clean and the proper products and systems to clean a room, and it's unnecessary for it to have to sit empty, and that triggers an automatic 30% or more vacancy rate instead of thinking that you've gone to 100%. So we would encourage some form of an option to safely not have to have a room empty 24 hours. Thank you.
Thank you. The next person is, it says Mark, 253-377-4594. I will unmute you now.
I was just here to listen to the meeting. Thank you.
Great, thank you. Steve Hausbach, comments or just listening?
Yes, I'm listening in and want to support the county's move to phase 3 in a safe and responsible manner. That's it. Thank you.
Thank you. The next one is, it says Islanders Bank, 360-378-1226. I will unmute you now. Do you have any comments?
All right, can you hear me? This is Scott Lewis from Islanders Bank and the Chamber President. Just want to support a move to phase 3, just keeping in mind that a lot of our businesses have already spent most of their tourist dollars from last season and don't have one this year, or not much of one, and what we have left would be encouraged to go to phase 3 so that they can make some money to extend their ability to pay their bills and whatnot. So anyway, I'm in support of phase 3.
Great, thank you. And just as we keep moving through this, I may have forgot to mention, if you could mention your name and which island you were from, that'd be helpful. So the next person I have is John Dustrude. Uh, 360-378-4306. Okay, moving on. I will come back and ask one more time. Lakedale Resort, I'm unmuting you now.
Good morning. This is Carl Bruno, Lakedale Resort, Friday Harbor. I'm urging all of you to move forward into phase 3. I also want to make sure that people understand that guests are incredibly respectful. Everyone is wearing a mask. Everybody is doing what they're supposed to be doing. So it's a different story than what I'm hearing from other businesses. Don't have any challenges with guests. They're appreciative to be out and about.
Thank you very much. The next person I have is Peter Lane. If you state your name and where you're from.
Hi, good morning. Peter Lane, San Juan Island. Just here to listen. Thank you.
Thank you, Peter. Next one I have is Gregory Lewis. Again, please state your name and where you're from.
Yeah, this is Greg Lewis, Friday Harbor. Just listening. Thanks.
Great, thank you. Lisa Gard is the next person. If you could please, again, assuming this is Lisa Gard, but state your name and which island you're from.
Hi, yes, my name is Lisa Gard. I live in Friday Harbor, and I'm the owner of the Web Suites and the Lazy G Ranch. And I listened in yesterday, and I just want to thank the council and the health department for all the good work they're doing. I do recommend we go to phase 3. I agree with Lakedale and the other inns. You know, if you have more than 3 properties, you are registered with the State Board of Health already. You have very stringent rules to accommodate all of the things that are going on right now. Nobody wants anyone to be sick. We already have these things implemented way before this virus ever happened. And anyway, I encourage us to head to phase 3, and I see everybody being very respectful, wearing masks and taking care of themselves. So that's my thought on that. Thank you.
Great, thank you. The next person I have is Lydia Miller from Orcas Island. Lydia?
Yes, hello, good morning. Dear Dr. Frank James, the Board of Health and County Council, thank you for your service. We will be dealing with COVID-19 for months, likely years. Islanders are exhausted by this ongoing debate over allowing businesses to reopen. We need strong, responsible leadership as we enter this new world. The reality is cases of the virus will continue to emerge throughout the country and on the island. Our local healthcare system is resilient and has handled positive cases as they have arisen. We have a well-thought-out system in place to test and refer patients for treatment as needed. We have been very successful at contact tracing. We are well stocked with PPE. The more we use our system, the more efficient it will become, and the more we will learn, and the less anxiety and fear we will have moving forward. The last 3 months have shown us that high-traffic businesses were allowed to remain open, and they have operated safely without endangering their employees and customers. Let's remember, those in the higher risk category can and should continue to stay at home and limit their exposure. Fortunately, we know so much more than we did in March when the virus began spreading. We have successfully transitioned to phase 2, and everything is working as expected. We are ready to move forward to phase 3. Thank you very much.
Thank you, Lydia. The next one I have is Madrona Point 3765707. Madrona Point, any comments? Okay. The next one I have is the press. Matthew Gilbert, do you have any comments or questions?
I don't know how they can enforce these quarantines.
No comment, just listening. Thank you.
I'm going to look up Orkin.
All right. Thank you. The next one is Ruth McKenna, I think. That would be 360-378-6172. Ruth McKenna. All right. Next one I have is Mike Pickett from San Juan. Mike, do you have any comments? Mike? All right. The next one I have is also from the press, Minor Lil from Orcas Issues. Minor, do you have any comments?
No comments. Thank you.
All right, thank you. James Nelson is the next person. Again, please state your name and where you're from.
Can you hear me?
Yes, sir.
Yes, good morning. I just wanted to make the comment in relation to the 50% rules that we've been dealing with, that for resorts and lodges, the 50% occupancy means 50% of the rooms. But for vacation rentals, it means 50% of the legal occupancy, which is generally 3 people per bedroom. So a 1-bedroom vacation rental would be limited to 50% of 3, which is 1.5. Means you can only have 1 person under these rules in a 1-bedroom vacation rental. In a 2-bedroom vacation rental, it'll be 50% of 6. You can have 3. And effectively what this has done is it's made it impossible to honor any of the existing reservations. Most of the people that come to these things are small families. So if the intention here is to go to 100% occupancy for vacation rentals, that's fine. But if it's to stay at 50%, that effectively is keeping them closed. And really, that's the only comment I had. Thank you.
All right, Jim, and this isn't going to be a discussion, but the rule is actually 2 persons per bedroom plus 3 people. So a 1-bedroom house can have 5 people.
Okay, if we could have some discussion of that during the meeting, it'd be greatly appreciated.
Great, thank you.
Thank you.
All right, the next person is, it says San Juan Island, 360-378-3277. I will unmute you now. You have any comments?
Hello, Rick and all. This is Deborah Hoskinson, representing the board of the San Juan Islands Visitors Bureau, which represents approximately 300 businesses. We'd like to thank Dr. James for all of the difficult decisions he's had to make, as well as the Board of Health, the County Council, and the Health Department. And we'd like to thank you all for reading the many emails and letters, including those from the business community. So in general, the businesses are ready to take the next steps to phase 3 safely, and Washington's new mask mandate will make it safer for everyone. I'd also like to add to all of you and all of those listening that we waited to advertise until we had the council's blessing, and our brand new advertising campaign refers potential visitors to our website, where there is language about wearing masks on both our homepage and our travel advisory page. This information is also pinned to the very top of our Facebook page. So we're working too to get out our San Juan Island Stay Safe pledge posters into all businesses, which ask both our visitors and our businesses to pledge to wear their masks, wash their hands, and follow local guidelines. So thank you all so much again. We hope to move into phase 3. Thank you.
The next one is the Outlook In. I assume it's Sarah Farish from Orcas.
Hi, Rick. Can you hear me?
Yes.
Okay, good morning. I want to thank you for your work, the Board of Health and Dr. Frank James, and I support going to phase 3. I also feel just, as I've been listening to all the comments, there are many people that I know, they're my friends, and I see these comments online, people that are opposed, that have varying different opinions on what we should be doing. And I appreciate the way that the Islanders have been kind and respectful and really tolerant of just very different opinions. And I hope that we can continue to be that type of place that can continue to support and be kind to each other, even as our opinions are very different. So the Outlook In and the New Leaf Cafe is ready to move to phase 3, and I just look forward to hearing your decision today.
Great, thank you. The next person I have is Skip. It says Skip Clark or Clark Skip 360-468-2207. I assume it's from Lopez. Hold on a second. Unmuted.
Hello?
Yes. Can you hear me?
Yes. Can you hear me?
Yes.
Oh, it's Shelley Clark from Lopez Island, and I want to thank everybody for all the work you're doing, and I am not in support of moving to phase 3. And my crew and I work at the ferry landing. We've been there through this entire pandemic, and what we're seeing now is a real increase in visitors from all over the country, and they don't have a clue what we're doing here in the San Juan Islands. And we're not seeing social distancing when they come off the boat or on the pickle forks. And I feel like we need to be very cautious. We are going to have visitors who aren't as careful in our community. We are all being very careful, but I don't know that we can expect that from people from other parts of the country or world who don't realize our delicate situation. So I would advise being very careful, because we can't make people abide by these rules. And from what I've seen at the ferry landing, they aren't interested in protecting our community. They're here on vacation and they're interested in having fun. So also I feel like the more people I see coming from other places who aren't practicing safe procedures, the less I'm willing to go out in the community, and I'm sure that there are other people in the islands who feel the same way. So anyway, I would advise being cautious and not putting too much on our visitors, not expecting them to really abide by what we're asking them to do. Okay, thank you.
Thank you. Marcy Stevens is the next one. The number is, well, Marcy Stevens or whomever is on this line. The next one is Tom Diller.
Good morning, everybody. Tom Diller with the Lopez Island Resort. I want to thank you for all the efforts and the thoughtfulness of the health board and the concern and all the steps that have been taken. And frankly, I'm pretty proud of the lack of cases that are in the county, and that's been responsible as we've opened up. I would just wanted to say that we have been practicing very strong COVID habits. We're vigilant on mask wearing, and we have distanced all of our guests and planned out so that we're not closer than 6 feet in the restaurant and that type of thing. And we have I think a lot of businesses will have the opportunity to kind of do different things and are to spread out people, and maybe we're trying to do more things that are outdoors, and not only that, we're really practicing a very strong room cleaning and turnovers, which include also disinfecting solutions on all the counters and in all the rooms. To that end, I feel the 24-hour wait on rooms is very difficult for anyone in lodging to accomplish, and I don't think it's going to accomplish the goal it senses it should. But I want to say thank you to everybody. If we don't open to phase 3, I think the employees are going to suffer. I think the small businesses are going to suffer, and I think we're all going to suffer all for the next year economically, whether it be in tax revenue or in the services that are provided by the tax revenues. And I just want everybody to think about all the different ages of people that are on the islands, and not just specific groups, because I think we're impact. Thank you very much.
Thank you. The next one is Windermere Real Estate. Windermere Real Estate, nothing?
Hi, Rick. Can you hear me?
Yes.
Oh, hi. This is Gary Franklin in Friday Harbor. You guys have such a tough job there, and I just wanted to say we appreciate the focus and diligence of the council and the board. Thank you for doing this. We support the county's move to phase 3 in a safe and responsible manner. It's a tough thing to keep people from coming here, and since they're going to come anyway, we just want to make sure that everybody's going to be safe and responsible, and I'll yield the rest of my time to the next esteemed caller.
Great, thank you. So I have three left, Dale. First one is a wireless caller, 253-820-5799. I will now unmute you.
Thank you.
Hello?
I'm just listening. Thank you.
Thank you. The next wireless caller is 360-378-7694. I'll unmute you now.
I'm just listening. Thank you.
Okay, and the final caller is 360-378-7689. Unmuted.
Hi, this is Laura Staccio calling from San Juan Island, owner of Earthbox Inn and Spa and the Bird Rock Hotel. I want to say thank you, Dr. James and the Board of Health, and your concern for this community, which I too share. I support the cautious move to phase 3 because without this, I fear that many of those of us who have lived on this island for decades will not be able to survive the coming winter without the opportunity to open up cautiously over these next 2 months of summer. Thank you.
Thank you. So I have gone through everyone that I think is here to provide public comment. I will give one last call. Is there anyone who is interested in public comment? If so, could you please unmute yourself, state your name, and speak?
Hi, this is Johannes. Can I make a comment?
Yes.
Yeah, so I'm from San Juan Island. Thank you very much for all your hard work. These are definitely very challenging times with very tough decisions to be made. The county and state, seems to have done a good job minimizing the spread of coronavirus and preparing for future cases. The business community is ready to open responsibly. San Juan County is in a delicate balance between protecting health and preventing devastating long-term impacts on the local economy. This community is positioned well to move to phase 3, and I ask that you do so in order for the community to survive long term. Thank you.
Thank you. Is there anyone else who would like to provide public comment at this point? One more call. Is there anyone else who would like to provide public comment at this point? All right, without seeing anything with the chair's approval, public phone comment is closed. Dale, I have one more 3-sentence line email that came in. I'm going to read it. Jamie Hance from Orcas Island. San Juan Island's lodging industry ready to move to phase 3. I want to remind Dr. James and council that we are at a critical junction here at the beginning of summer. We must move forward to phase 3. It has been shown that the islands can handle cases of COVID-19 and manage it properly. Mr. Chair, I think that is all of the public comments. I appreciate your indulgence for allowing me to go through and ask these questions. Meeting back to you, sir.
Great. Thank you very much, Rick, and thank you for processing public comment. Thanks to all the public for participating. Your input is essential. We'll move on to Dr. Frank James, Health Officer recommendation. Frank?
Thank you. I've asked Mark, Kyle, Ellen, and John Kane to make brief presentations of some of the background information on core issues that we'll be discussing. Mark, could you go first?
Sure. Yeah. So I'm going to share my screen so folks who have the Skype can see this. And so if you were in council yesterday, you have this is round 2. And so up on the screen right now is the phase and risk assessment for Washington State. This shows phases by county and then the Washington State key metrics and whether the state's meeting those goals or not. Just for folks on the phone, currently there are 5 counties in phase 1 or a version of phase 1. There's several more modified phase 1. 19 counties are in phase 2, including San Juan County, and 15 counties are in phase 3. You can see up here that there are 5 Washington State key metrics, and the state meets 2 out of the 5 statewide. So the rate per 100,000 of newly diagnosed cases, and for the prior 2 weeks, the goal is less than 25. And currently Washington State.
Mark, this is Jamie. I'm not seeing it on my screen. I've got a big blank spot with your picture on it. I don't know if anybody else is having that issue.
We have it here in council chamber.
Yeah, I can see it fine. Okay. Must be me.
Oh, okay.
Thanks.
Yeah, go ahead.
The link really quick to Mr. Stevens so he can pull it up on a browser.
Yeah, it's the coronavirus.wa.gov/what you
I've got it pulled up.
Okay.
I've got it pulled up.
Okay. And so the rate per 100,000 went through that. The next one is number of individuals tested for each new case during the prior week. They're looking at greater than 50. As a state, we're at 25.3. And then percent of individuals testing positive for COVID-19 during the past week. The goal is less than 2, and we're at 3.9. The other 2 measures that we're meeting are around hospital beds. That includes the percent of hospital beds occupied by patient. The goal is less than 80. We're at 65.5. And then the percent of beds occupied by COVID-19 cases. The goal is less than 10, and statewide we're at 2.6. I'm going to go ahead and select just San Juan County. And then I'll also select our region. And this has been updated. So this is San Juan County. And so right now it shows that we're in phase 1. And through, I believe it's June 20th. So the data, you have to look at the actual metrics, what they're measuring. We're meeting all of the goals. So the rate per 100,000, we're at 11.7. The number of individuals tested, we're at 129 for each new case. We're at 0.8 for the percent positive from the past week, and our hospitals are at licensed beds occupied are at 10%, and none of them are occupied by COVID patients. I'm going to go ahead and click over to the hospital readiness. and this is a new graph. So this shows the goal at 80%, and you can see where we are at as the county goes, and this is being updated. So you can see it goes from 0 occupied up to 20% have been occupied. And then the number occupied by COVID patients is 0. And I'll go back and look at it for the region as well. This is just for the critical access hospital here on San Juan Island. Testing capacity, you can see that this is making sure that we're doing more than 50 for every new case. So starting back in April 13th, forward until recently with several new cases, we have been exceeding that goal in Washington that Washington State has established. And so with the new cases, we have dropped below. With all the work that Ellen has done with 60 plus tests this week already, we'll probably bounce back above. But we are, for the most part, have been exceeding this goal for 2 months now. And I'll go through as a region as well. The other area is on the disease activity, and this includes our most recent test. So you can see that for several weeks we were at 0 cases. We had a new case last Monday identified that bumped us up to 5.8. The second case bumped us up to 11.7, and then the third case has us up to 23.3 per 100,000, and so that's through June 20th. So that's where we're at as far as disease activity, still meeting it even with the 3 new cases. I want to just select not just San Juan County, but also just select our region and go through this really quickly as well. So that you can see what, as we add in the other counties for our immediate neighbors, how it looks as a region, knowing that Skagit, Snohomish, and Whatcom are in phase 2. Island is in phase 3. So this is the rate per 100,000. The last time it would say is what I would say is truth, which means that they have confirmation, which was through June 17th. We were at 24.4 cases per 100,000. It does bump up as these new cases have been identified, up in about 32.2 cases. If you look at the healthcare readiness for our 5-county region, we're still meeting that with 73.8 of the licensed beds being occupied in the 5-county region. If you look at the number occupied by COVID patients, it's 2.5, so well below the 10. And so these are the hospitals that we generally utilize to send off our patients for a higher level of care. If you look at testing capacity for our 5-county region, you can see that if you go back in through the latter part of May, as a region, we were meeting that. We have fallen below as some additional cases have been identified. But for a region, we were meeting it in the latter part of May, early part of June. That has fallen as additional cases have been identified. Percent positive, you can see we've been hovering down there around 2%. And if you just go 2% all the way along, and it's kind of ticked up recently to about 2.6, and with the recent ones about 3.7. If you look at the disease activity, you can see back in the March 18th through March 31st, we were at 100 cases per 104.3 cases per 100,000 in the counties. And right now, again, we're at the 24.4, and it's kind of ticked up. Dr. James also wanted me to talk about the reproductive rate. And this is the R0 value. And so this here shows Western Washington as a region. Right now it is estimated at 1.2. Ideally it would be below 1. And you can see the confidence levels. They go anywhere from a lower confidence interval of 0.5 to an upper of 0.9. And you can see back at the end of May here, May 11th, it was below 1, and it's kind of been upticking a little bit, 0.9 into the end of May, and now it's anticipated at 1.2 with that confidence level, those error bars anywhere from 0.5 to 1.9. So that's the information that Dr. James wanted me to present. I'm going to stop sharing my screen, or I'll ask if there's any questions before I stop sharing my screen.
Any questions? Thank you, Mark.
All right.
Kyle, could you relate to us what you know about the hospital preparedness in the assessment that you've done with both our hospital on island and our hospitals that we refer to?
You betcha. So Kyle Dodd, Environmental Health Manager. The Department of Health application to move between phases requires us to not only describe our local-led response efforts and capabilities, but also requires our hospital partners to submit letters indicating their capacity to respond to COVID-19 cases. Similar to the variance application to move from phase 1 to phase 2, where we received letters from our hospital partners, and our hospital partners are both Peace Island Medical Center and St. Joe's, both of the Peace Health System, and also Island Hospital in Anacortes. We received letters from them indicating their capabilities to move to phase 2. The phase 3 application that is up for consideration also requires hospital letters. There are some unique differences that DOH has added for these updated hospital letters for phase 3 than there were for phase 2, and I'm going to briefly hit those high points here. So our hospital partners are asked to identify the following: the percent of licensed beds occupied by patients, the percent of licensed beds occupied by suspected and confirmed COVID-19 cases. Number 3, they have to affirm that their hospital is reporting and will continue to report daily all the data requested by the Washington State Department of Health into WA Health, their hospital reporting system. Number 4, that the hospital has at least a 14-day supply on hand for all the following PPE, including N95 respirators, surgical masks, face shields, gloves, and gowns. And finally, to reaffirm that if or when the hospital is using PPE conservation strategies, that no staff person is wearing any one N95 respirator or surgical mask for longer than one shift, and that they are following the PPE guidance on reuse or extended use in the Department of Health guidance document. So I have requested updated hospital letters from both the Peace Health System and Island Hospital. I did receive a letter from Island Hospital, and I have a verbal from Peace Health that they are working on the letter. So that's the current status of our hospital partners. I can answer any questions.
Questions from anyone?
Kyle, this is Jamie. So when does Peace Island think they'll have the letter?
I indicated that last week when I requested it that we were shooting for today. I had a conversation with them on Monday. They have an administrative process to turn out those letters, and Marianne was going to follow up on that day. I reached out this morning and have a voicemail in, and that's the latest information that I have.
Thank you.
Any other questions? Frank?
I also ask Ellen to keep us up to date and give us current information on testing and also what the clinical situation is, separate from the statistics, how it's actually going on the ground, if you will, about the current cases being assessed in San Juan County. Ellen?
Good morning, Board. This is Ellen Wilcox. I'm the Operations Section Chief for the COVID Emergency Response. Under the Operations Section, we have ensured that EMS and transport plans are in place for transporting patients safely off island, that we have fatality plans in place for any fatalities related to COVID. We have also completed our surge planning and behavioral health activities and outreach. So those are no longer operational, but could be stood up if needed. And we hope we don't need those activities in place, but they are ready if we need them. What we are focusing our efforts on at this point really is on making sure our most vulnerable populations are protected. We have over 4,000 home deliveries that have gone out. Those are meals and supplies to our most vulnerable populations to ensure they stay safe and home and protected. In addition to that, there are 500 meals being delivered each week across the county, again, to make sure our most vulnerable are able to stay sheltered, stay safe, and stay healthy. We have also deployed over 14,000 masks out of the state emergency or our county's response center in an attempt to keep our communities safe. The majority of our focus, especially in this last week, has been around surveillance and testing. So I'm going to highlight some of the efforts that are underway with outbreak and case investigation, and then I'll talk about our testing updates. As I think all of you are well aware, we have gone for quite a long time without seeing any new cases. We had a spell of cases in March and April, and then about a 6-week break from any new case activity in our county. I think that's extraordinary considering how well traveled our community is, and I think it's a reflection of how well prepared our community became as a result of COVID. Last Monday, the June 15th, we did see case 16. That was related to an exposure of an incoming person at Roche Harbor, a staff member there. We quickly stood up testing efforts to test everyone around who had been exposed to that case. And we're able to very rapidly do the case investigation, all contact tracing, and testing to contain any further spread. On Friday evening, the 19th, case number 17 was identified. That was a positive test that came back for a resident at a long-term care facility here in Friday Harbor. We stood up a case investigation that was completed within 24 hours, as well as all contact tracing completed within 24 hours. So well within the metrics that the state has required us to have in place to fully stop the spread, or to slow and stop the spread. We also stood up a ring testing event. Ring testing is when you have a confirmed positive case and have identified close contacts, that you set up testing for them to ensure that we've gotten everyone who is in that proximity tested and quarantined. That's an extended effort for a long-term care facility, because one case in a long-term care facility is considered an outbreak. We tested 61 people related to that lab-confirmed positive case. And then on Saturday, we received notification of case number 18, which was a case on Lopez. It only had contact with close household members. They were all tested, and those test results were negative. Last night, we did receive notification of an additional case. We are still sorting out whether that case will be assigned to Seattle-King County or to us. This is somebody who has a residence listed in our county. However, that person has not spent any time here in many months. So we are sorting through that. I know there are lots of questions in the community about whether contact tracing efforts are complete or done at 100% effort. I want to assure people that we have been able to reach all of our confirmed cases well within 24 hours, complete that investigation, and identify all close contacts. Some in the community may feel convinced that they've actually had an exposure. We have a very highly trained surveillance team who are very good at identifying with very precise measures whether somebody has actually had an exposure. Maybe someone's been in contact with a confirmed case, but not during the time that that person was infectious. And that's exactly what our contact tracing team does, is drill down to those who are actually exposed, contact them, and make sure that they are given the instruction to stay put, stay safe, and get tested. And we've been very successful. I want to thank our teams for working, really around the clock, especially this last week. Most of these results have come in around 4:55 in the afternoon. So these calls are going often until 10:30, 11 o'clock at night, and then starting right back in at 8 o'clock in the morning. So we have a very dedicated and very well-trained team leading these efforts. On the testing front, we have tested in our county as of last Friday 1,459 individuals. That is close to 10%, especially when we count this week's numbers of our entire population who has been tested. Part of those testing efforts have included 300 asymptomatic essential workers who were tested during the month of April. Those resulted in no positive cases. We have also been working with the long-term care facilities to ensure that the state mandated testing requirements that all staff and residents in long-term care facilities are tested between April 1st and July 31st. And we have stood up ring testing events, one at Roach Harbor and one at the long-term care facility, to rapidly identify whether there are additional cases associated with the confirmed case. We are also standing up asymptomatic essential worker testing. It's employer-based testing, and those are efforts that are focused on businesses who have more than 25 employees and wish to have their employees tested. We've done significant outreach to the business community and are scheduling those tests with first priority going for ring testing efforts related to a confirmed case, and also an ongoing priority to do some sentinel testing through essential worker asymptomatic testing efforts in our community to ensure that we are staying safe. With that, I will stop and ask if there are any questions.
Dr. Heisinger, this is Rick. Can I say something really quick?
Yes, please do.
Alan, I just wanted to say thank you. And I hope, and not that I have the authority to request this, but I want to make sure you and the staff that you have, which are doing amazing work, start to begin a rotational time off. I think that you guys have completely executed the plan that we put together. That gives me confidence that we move through this phase system, but this wouldn't be possible without you and your team. So I just wanted to say thank you.
You're welcome.
Ellen, this is Councilmember Watson. I didn't hear any results from the Village at the Harbor testing effort.
The results that we have back so far, we do not have any positive results related to that.
So you haven't seen the press release that Brendan Cowan has released?
We have, what I will state is we have not received any positive results as a result of that testing. Not everybody has been notified of their test results.
Well, then maybe Brendan jumped the gun in issuing his press release that I'm looking at right now on my computer.
No, Brendan didn't. There is a balance between two things going on there. One is, it is our policy not to inform the public and let alone anyone else that of results until we've informed the provider and given them an opportunity to inform the patient. That's our basic policy, and that's the policy that Ellen is respecting. There are times when public policy also demands that we inform people about results. And Ellen is being very precise in saying what she's saying is that there are no positive tests. It's considerably more complicated than that. In this case, there may be some conflicting results between data points that we have, and there needs to be additional testing to resolve them. And a public forum is not the place to resolve those kinds of issues. Suffice to say, she's entirely correct in saying we have no additional positive tests. And I hope you can be patient about that.
All right. So have you seen the release that Mr. Cowan just issued minutes ago?
I have, and it is accurate.
But it's public information, right?
I realize that.
Okay.
I'm sorry. There are sometimes different requirements on us that can conflict, and I apologize if that's confusing to other people.
All right. I just wanted to make sure the public message was the public message.
Yes, it is.
Okay.
Any other questions of Ellen? Ellen, thank you very much. And I second what Rick had to say. You folks have done an outstanding job to benefit the health and safety of us islanders. Thanks. Frank, do you want to proceed?
There was actually one more person I wanted to have speak, and that's John Kane. John is our legal counsel, and this is a complicated process we're going through, and I asked John just to clarify how it works from a legal point of view. I have now provided you a signed copy. The first one I sent was unsigned and dated. Of my recommendations going forward, they are a summary of a more complex discussion, obviously, but they are what I'm recommending to the board. I then want John to clarify what the process is here going forward. John?
Thank you. Good morning, Mr. Chair and Board of Health. It's John Kane, Deputy Prosecuting Attorney. I wanted to just go over the process a bit with you, explain the Board of Health's role and the other steps here. The last time that you met, it was to consider a variance to move to phase 2. And since that time, the landscape has changed with the governor's latest orders. And now in this Safe Start plan, each phase lasts for at least 3 weeks, but you can ask for a move to a different phase at any time after you've stayed in a phase for 3 weeks. You can ask to move forward. Anytime you can ask to move backward. And the way it works now is step 1 is that the health officer submits a signed and written recommendation to you about really with one of 3 options: to stay in the current phase, to go forward and fully implement the next phase, or to partially move to the next phase. Those are the 3 options, and the next steps for the Board of Health to decide what to do. So here you have the health officer's written recommendation, which I would characterize as moving forward to a modified phase 3. And the Board of Health has the authority to decide yes or no on moving forward to phase 3, and you also select which, if any, modifications you'd like to implement. In other words, would you like to fully go to phase 3, or would you like to modify phase 3 in some way? And what modify really means in the context of the governor's framework is, how do you not want to move to phase 3? What modifications will you make to stay in phase 2 or stay in phase 1 with respect to a particular activity? For example, do you want to move forward to phase 3 but prohibit large gatherings, for example? The third step is the council action. The council's authority is a bit more limited because the council has the authority to approve or disapprove of the plan from the Board of Health. In other words, if the Board of Health elects to move forward, the council can say no. If the Board of Health recommends moving forward with modifications or without modifications, the council doesn't have the authority to change those modifications. The council just has the authority to give a thumbs up or thumbs down, yes or no, on moving forward in the application process. And if both the Board of Health and the council wish to move forward, the next steps are what I would describe as the more clerical steps of obtaining the hospital certifications, as Kyle Dodd described, getting the application materials together. The application consists essentially of a variety of data about the preparedness of the county, about the health status of the county, the preparedness of the region. And the last step in the process is that the Washington Department of Health makes the final decision about approving the move forward to phase 3. They can deny it. They can modify what the county has suggested. Those are their three options, although what we've seen in practice is they can also choose to delay. They've done that from time to time, had some communications with the requesting county, maybe proposed some modifications or waited to see how testing worked out before authorizing a move forward. Last, I want to note that as we move into the future, if there are changed circumstances in the future, the Department of Health can always modify the county's status. In other words, if we had many large outbreaks in the county today, you could expect the Department of Health to tell the county that we are moving backwards. That's not the case today, but it can happen. The Department of Health could also modify our status, keep us in the same spot. And likewise, the county can submit rationale and data to the Department of Health at any time in the future, asking to move backwards to a previous phase or to modify the existing phase. So that's the outline of how the process works, and I'm happy to answer any questions you may have.
Are there any questions? Thank you, John. Frank, do you want to proceed now? Dr. James?
Sorry, I was on mute. And have multiple documents open on my desk. So I just wanted to say that a few comments to contextualize this. There is no perfect answer to the questions we face today. These are the most challenging times I've personally ever faced in my life. The virus itself and its basic biology is going to determine how far we can go and how fast we can go in our efforts to bring increased economic activity to the businesses in our community. No matter what we do, we will need to be vigilant about face coverings, washing our hands, and simply staying 6 feet from others that we don't live with. While these seem like very simple things, they're the most important things that we can be doing as a community right now. If we do those things and do them well, we can expect this disease to go away. Most infections that occur in homes in a family setting where these activities are relaxed. But it has to get to that family setting first. So the vast majority of cases, if you look at the big numbers, are acquired in a home setting. And the question is, how do they get there? We have to deprive that virus the opportunity to get into those people's homes and control the spread of the disease in that way. And that's how our community can be successful. However, we have to do that over very long periods of time. My best estimate is we're going to have a decreased number of cases over the summer. And when school reopens in the fall, we'll probably have a significant resurgence. There's a great deal of data that suggests that. There's also a lot that we don't know about this disease, just basic information that is still emerging. Initially, we didn't know if it was infectious from asymptomatic individuals. We now know that we're most infectious in the 48 hours before we develop symptoms, and that as many as 40% of people or more don't have any symptoms at all. These are daunting facts and make challenge our ability to move forward. Fortunately, we do have an effective test. No test is perfect. There will be false positives, there will be false negatives in any test that's done. You just have to do enough tests. Even the best tests aren't good enough, because even if the test is 100% accurate, there is mislabeling, there is mishandling, there is inadequate collection. There are many things that can modify even the best test. These basic facts, and as we move forward and learn more about this disease, are going to determine what happens in our community. We will not be free of this menace until after a vaccine is developed, deployed, and utilized. I'm on one of the committees at the university that is working on one of those vaccines. It will probably be deployed on an experimental basis in our region in the next 2 weeks. Nonetheless, even that vaccine, which is one of the 7 frontrunners and most likely to be deployed widely, those results will not lead to an effective vaccine at the very earliest January of next year. Typically, most people believe it's going to be 12 to 18 months, and in history, there's never been a vaccine from scratch to deployment in less than 4 years. So that January date, that's optimistic. The work life of our community is critical to the success of our community over time. I believe that at this point in time, as you've heard the reports, that our staff is ready to find any new case quickly, to isolate the ill and quarantine the exposed. They have a proven track record of being able to do that. And as we go through the kind of whack-a-mole events that are going to happen over this summer, I believe that we can identify those cases and control their spread effectively. I believe that our hospitals and clinics are prepared for the case identification, testing, and provision of medical care, both for the mildly ill and the critically ill. I think we're in good shape on that front. Most likely, people from out of our county are going to be the source of cases going forward. Many people fear the tourists that walk our street. So far, it is more likely to be a family member or a trip off island of an islander that has brought the disease into our community. Both are real issues. Both are concerns that we need to monitor carefully and modify in favor of being a disease-free community as much as we possibly can. Fortunately, the entire state will now follow our lead in wearing masks as a way to reduce the risk, especially inside of businesses. We've led the way in that, and will continue to lead the way. There are significant challenges that I don't think we can minimize. The number of cases are increasing in our state, and they're increasing on the west side of the state. These are going to be some of the most challenging things that we face. We've done a good job with what we've been given so far. We're going to continue to be challenged. The things in phase 3 that I'm going to recommend we do, I think are safe, and I think can be done in a way that provides some economic opportunity and yet protects our population. I believe that expanding the 75% of capacity for eating establishments is a very reasonable thing to do at this point in time. I don't think that expanding to tables of 10 makes sense in our community right now, however, and I'm recommending against that. The current requirement that all seating people are seated 6 feet from each other already makes that an unlikely benefit to our community. So 75% capacity for eating, yes. 10 at a table, no. I believe that opening museums and libraries can be done safely in our community and will add added value to our citizens and our visitors. I believe that gyms and pools can operate at 50% of capacity safely and that they're prepared to do that. All other businesses, except for a few, I think, can now open for business. There are some exceptions, and these are detailed in the governor's list of things that should be opened only in phase 4, and I agree with that. They should not be allowed until phase 4, and that list is in the governor's phase 4 language. Government services, in fact, the customer-facing portion of them should now be opened and should be open to the public. There are, of course, masking requirements and distancing requirements that those government entities and businesses will have to follow. There are some things that I think should not be adopted from phase 3. I believe that opening up to groups of 50 indoors is not something we can do. I believe that we can open, however, groups of 50 outdoors. The risk is significantly less outdoors. This will make way for weddings, some sport events, and some camp activities that we couldn't otherwise do, and I think it's an important opportunity for us going forward over the summer to allow those groups of 50 outdoors, and I believe the risk to indoor groups of 50 is greater than we can bear. At times, our hearts can confuse our brains, and this is a time for extreme caution and care in our decision making. I hear every day from thoughtful, informed, and frightened people in our community that are honestly desperate for their lives. Those people need to be honored and asked to do what they can do to protect themselves, and we need to do what we can do to protect them. I also hear every day from people whose life savings and way of life are slipping away from them and crushing the dreams they've had for their lifetime. We need to give them the opportunity to make a living if we can do it safely. We need to balance both of those things. I believe that the recommendations I've made are a further step in that direction of balancing that difference. One person's incapable of knowing exactly what to do at this juncture. I know because I am one of those people. Our leadership at the state level has wisely created a process that requires multiple steps in decision-making on this issue. Your role as a Board of Health will be to take my recommendations and evaluate them critically, not to simply accept or reject them. You are free to take what time you need to make this decision, to gather more information, input from others, to deliberate thoughtfully among yourselves, to listen deeply to the interests of everyone in our community. I tried to do that myself, to present the facts as objectively and accurately as I am able. Be mistrustful of those who are certain in their opinions, as there are unknowns that are significant. We don't know when people traveling off island to the mainland will meet the wrong person and become infected. We don't know when close relatives will come to visit and bring more than a smile with them. We don't know what will happen when the many communities from which people come to visit our community what will come with them. We don't know how the organism itself will change over time. We don't know when people will tire of doing the right thing. We don't know how youth with little to risk will simply stop following our recommendations. We don't know what will happen in the fall when school restarts and the risk will go up significantly for community spread. There is much, much more we don't know. We learn about this organism every day. We will continue to refine our knowledge and improve our understanding, and the facts will change. What we know now is going to change is the only certainty we have. The Board of Health is structured to have health experts, regular citizens, and elected representatives of the public so that all interests and information sources are represented. This decision is now yours to process and ultimately decide. Please take due time and due caution in making your decisions. One person cannot see all sides of an issue or know all the information needed. Particularly, I want to point out that I was not trained, nor I am an expert in economics or business, and the long-term interests of our community involve more than just medical information. I offer you some thoughts about those issues, but defer to your collective judgment to steer our way going forward. You have the power and responsibility now to guide our future. You may change anything, any detail in this of what I have offered. You may change the fundamental recommendation or any part of it. You will then pass it on to the county council, as John has mentioned, who will have the responsibility ultimately of deciding yes or no. There are several things that aren't directly addressed in this recommendation to you today. Travel to our community is regulated by the state of Washington. It should have been limited to travel only until now. Local travel only, and that clearly hasn't been the case. We will honestly move forward to unrestricted travel with this decision. The capacity for transient accommodations, moving from 50 to 100%, is linked in my order to automatically go forward to 100% with the adoption of Phase 3, probably the most significant change that's going to happen with this move, and it's not actually part of Phase 3. But it's linked to our order and how it's related to Phase 3. Finally, I just want to say that moving back to Phase 2 or Phase 1 is possible. How well we do things as simple as wearing masks, washing our hands, and staying distant from people as a community, as a total community, will determine whether or not we move backward to Phase 2 or even Phase 1. That may need to happen in the future. It would be mandated by a community-based outbreak that was sustained. If that happened, we can and should move back to Phase 2. If we experience just more isolated cases with limited spread, we are prepared to manage those effectively at this time. And it is that confidence that gives me the confidence to recommend to you we should move forward to Phase 3 at this time in its modified form that I've shared. I do want to share a few more pieces of information, and I'm don't have the skill that my colleague Mark has, but I'm going to try to share my screen if I can do that. And so there bear with me if I'm not successful. I'm trying. This is when you wish you were in the same room with your colleague. I'm actually not going to be able to because of the privacy settings and the particular nature of our configuration of my email system, my computer system and the particular host we're using. Suffice to say, I'll just describe the documents I was going to share. One is the RO for the state comparing the east side and the west side. That is the R0, the reproductive rate. When we're below 1, this disease is on its way out the door. When we go above 1, it's replicating. What it shows is that in the past few weeks, our reproductive rate on the west side of the state now exceeds the reproductive rate on the east side of the state, and that's never been the case in the past. It is also above, the most recent data shows that it is above the break-even point, if you will, where you decrease or increase cases significantly. That's a significant thing, and we need to pay attention to it. The second slide that I show you basically is a slide of predictions. The governor, in his wisdom, asked us to consult particular data sources for this information, and I consulted them duly.
Frank?
And yes.
So I think I have up what you're talking about on the screen. Is that what you're looking at?
Just a second, I got to come back. Yeah, that's a different version of it. Yeah, the one I had actually had east and west both, but that's it. Thank you very much for adding that back up.
Can you tell me what you want to see?
You can't get there from here, unfortunately. It's a different link.
Should I not share it then?
Oh no, it's fine to leave it there. It's the same information without the piece from the east side that shows the east side's going down. And then the next one is just a projection through October. And what that projection shows is that over the summer, over July and August, we're probably going to see a minimal number of cases. And then at the end of August and pretty significantly at the beginning of September, they're predicting a significant increase in cases. So I think as we plan, we got to know that when school starts, basically, we may have to go to phase 2 or even phase 1 in the future. And we just need to be aware of that and understand how that would happen. John has very kindly crafted my orders in a way that allows those orders to move with the phase changes. Those phase changes may be our choice and they may be the state's choice. But know that there will be another time of substantial risk starting around the end of August, beginning of September. And the one other thing, and I'll share all of these with you, I'll send them to you individually right as soon as I'm done speaking. There's another document that in one of those sites that was asked by the governor to evaluate, and it looks at the relative benefit and risk of various aspects of economy relative to increasing cases and economic benefit to the community. It's something few people are expert in, and there is some data out there to guide what we're doing going forward if we have to further modify our current restrictions. And again, I apologize for me being certainly not a Luddite, but not being able to share these slides with you at this time. They will be in your inbox, though. Thank you very much.
Thank you, Frank. Are there any questions from the Board of Health?
Yeah, I have one.
Go ahead.
Oh, thank you. So, Dr. James, I might have missed it, but I know a lot of participants on the phone. So what is the standing for transient accommodations if we go to phase 3? Is it 100%?
Accommodations will automatically go from 50 to 100% occupancy, with the caveat that there is that 24 hours between occupancies, which does decrease that rate significantly. And I'm not at this time prepared to change that 24-hour rule. I am evaluating ways that could be done safely, and both for the point of view of the occupants as people that it's rented to, but also for the cleaning staff that need to go into that space and clean it. Those two considerations are still being evaluated, and the nice thing about orders is they can be changed anytime at the stroke of a pen by me. And so when we get adequate information to change that, I would like to change it, but I need to find all the evidence to make certain that it can be done safely. I understand the economic importance of it, but right now we're going from 50 to 100. However, the caveat of the 24-hour period between occupancies will remain in place.
Great, thank you.
Thank you, Frank. Any other questions from
Dr. James?
Yes.
This is Jamie. Could you clarify I was reading your recommendations and I like that you included about what we should have in our advertising for the county. I think that was a good addition to your recommendations. But could you clarify the indoor quantity of people, please? The usual path forward, if you adopt the entire phase 3, would be to allow groups. Currently, up to 5 people is allowed. This would allow between 5 and 50 to be allowed. So up to 50 people. And what I'm recommending is that we adopt that for outdoor activities, so weddings or camps or sporting events, that up to 50 people could be say in a marathon or something. On the other hand, I don't believe that we're ready to have 50 people indoors at this point in time. So that's the distinction there.
So it's still limited to 5.
No, it's up to 50 outdoors. It's limited to 5 indoors.
That's what I meant. Thank you.
Yes. There are 2 other things that I didn't talk about that I should talk about now. Is that I'm recommending 2 additional requirements. One is that all county-supported advertising for visitors include information about face covering requirements. That has been brought to my attention many times, that the current advertising by the Visitors Bureau in the Seattle radio market is saying, come on down, without any information about the face coverings. Now, our face covering rule is more restrictive and different than the states that they modeled theirs on ours. But one of the differences is that certain people are restricted from entering businesses in our community that wouldn't be restricted from entering them in other communities, and our businesses are required to accommodate those people by providing curbside service and delivery service, so mainly food and medicine. And so that's going to be different than the state, and we need to make sure that people appreciate that difference. It is our rule, I think, protects people more effectively. I understand why the state did what they did, but our rule is more restrictive in that particular aspect. And I certainly think people coming here hopefully will respect the state rule as well as our rule with respect to face coverings. Mounting data daily, there are things published showing the efficacy of that intervention. And I think it's very important to let people know about that expectation before they get here. The second thing is that I feel it's important to effectively educate the public about social distancing and face coverings, and that the Board of Health itself, potentially with funding through the County Council, could make that education kind of boots on the ground, so to speak, to have people at the ferry terminal, to have people on our main street downtown to help educate people about the importance of that, potentially distributing masks, potentially producing information. I think that we've done a great job in the press, but I honestly think we need boots on the ground on this, and I would see that as a activity of the Board of Health. They can certainly direct that. Any funding for it would need to be approved by the County Council, however, and I don't think it's that's something that we could plan to do. I don't think we need to do it, have that be a finished thing today by any means, but I strongly recommend it.
Frank, this is Jamie again. I knew there was something that was not quite clear. You know, with a restaurant, we're saying they can have 75% occupancy, which means they could, large restaurant like Mr. Diller was explaining, the Islander on Lopez, could effectively have more people in his restaurant than we could have in the Lopez Community Center with the less than 50, with the only 5 people indoor rule. Have you considered like a percentage of the, I don't know, fire marshal's capacity or some other way of measuring the metric?
Jamie, that's a really good point. I mean, these metrics were made up at the state level on the fly, and they were good ideas. I think we can refine those ideas. I would be happy to work with you on some method of doing that. And again, this is my recommendation to the Board of Health. The Board of Health, you folks now can modify this in any way you see fit. And if there is a better way to do it, and you can do that today, or you can do it provisionally today and modify it next week. And I can help you with that. But there may be other people who want to consult about it. So I hear your point, and I think it's certainly worth considering. I would recommend making this change now and
then evaluating going forward how we can modify it to improve it.
Yeah, I think I agree with that. I don't like making decisions like that on the fly.
And the nice thing about the orders, the health officer orders, is that those become effective when I sign them, and so they're very nimble, and I don't seek the power of controlling that process. I want all the input I can get when I do that, and I want it to be as science-based as possible. So one challenge with our relationship with the state is we can make things more restrictive and not less. So we'd have to carefully review anything we do to make sure that it fell in line with the legal requirements that govern state and county activity. But as I said, if we can do it by order, I can do that. And it's a nimble process.
Any other questions?
James? This is Rick. Can you hear me?
Yes.
Dr. James, so a couple things. First of all, I'd like to pass along the same sentiments that I mentioned regarding Ellen and her team. I'd like to say the same to you. I appreciate the humanity that you bring to this difficult process. I can hear it in your voice how hard this is. And so from the bottom of my heart, I appreciate your efforts to serve San Juan County as completely as you have. So thank you very much. And again, not that I have the direct authority, but I hope we can put you on some kind of break rotation so you can maintain sanity over what will be a long time. So
thank you, Rick. I've been looking for the opportunities, and every morning I get up and I do yoga and meditate. I don't know if that helps a whole lot, but it's a half an hour or 45 minutes of peace that I do have every single day, and it's one of the things that keeps me going is just that peace in the morning. And, you know, Steph is gone right now, and she's one of the critical people in our response team. And we managed, Nancy has stepped up, others have stepped up to fill those responsibilities. But we do have to get people out. This isn't going to be over till January, and it may be a lot worse in the fall. And so our core infrastructure people, they need to take a break, and I'm looking for those opportunities. Thank you for your concern.
Great, thank you. And again, I apologize for, there also needs to be many thanks to Brendan, Kyle, and Mark, Mike Thomas, and the remainder of the Health and Human Services Department for all their work, and the EOC crew. And I don't know all their names, so I apologize. I have a few quick questions for you, Dr. James, regarding this letter. The first one is, when you talk about all businesses can now open except for nightclubs, concert venues, and large sporting events, can a concert venue in an outdoor location that's under 50 people be allowed?
Though that is the language of the governor, and I would look to him for his rules for clarification about that. John Kane, are you still there, and could you address that issue?
Yes, this is John Kane. I'm still here. The governor's order is specific that concert venues remain closed until phase 4. So that's my reading of it.
Right.
With what the governor's office has been doing is very regularly issuing amended guidance that is industry specific. So I wouldn't be surprised if the governor were to issue some kind of clarification or change to that, but that's not something that San Juan County has the power to change. That comes right from the governor's orders.
If possible, I would love to find out if staff or you, Mr. Kane, could look up the definition of a concert venue. I think the intent is an indoor facility, just the same thing as a large sporting event. So it'd be great if we could have some clarification on that. Again, I think Mr. Stevens asked the same question I had on indoor gatherings. Could there be a number like 25 instead of 5? And I think we talked about going through a process to figure what that right number could be. So my next question is regarding the bar areas in restaurants and taverns will not be allowed to open at 25%. Does that apply to a outdoor bar, if there is such a thing, and then the second question is, we have facilities like breweries that have bars. I assume this just means when you walk up to the bar and you're sitting very close to someone. That is what that is, correct?
Exactly, and also very close to the servers behind the bar. That's what gives me reservation about it. And then they're the last person you want to be infected if there is bar service, because they're right there with everybody.
Okay, so again, if we could be ready to define that, if someone from a brewery or a winery or something wants to call and ask about that, because it's kind of muddled space between what a bar is and what the rest of the service area is.
Right, and the idea is that the seating area would be treated as any other restaurant space would be treated.
Okay, great. Thank you very much for that. And for full disclosure, my mother-in-law operates a theater, but I'm interested to find out, I guess that falls back into the indoor capacity. But the same thing that Mr. Stevens brought up, you could have 25 people in a restaurant the same size as a theater. And how is that, if you can provide social distancing, how is that not allowed?
The theater piece is for a couple of things. The risk of transmission is related to the duration of exposure, and movies are not brief encounters. And secondly, seating in most theaters, at 50%, you would not be 6 feet apart. And I think that's something the governor, in crafting his information, didn't think carefully about. So I think it might be possible moving forward in discussions with the theater industry people to find some practical way to open them at 20% or 30% or some number. It will depend actually on there's only, I think, 2 theaters in our county. I'd be happy to work with those people to find some way, if they're ready to open, to identify the right number. 50% as proposed by the governor in phase 3, I believe is not safe. It may be possible to identify a number somewhere lower than that would be safe. But because of the long duration of exposure and the proximity of people, I think it would be unwise to adopt the phase 3 standard.
And Dr. James, not to contradict you, but there, in my opinion, there's technically 5 theaters on the island, or maybe 6.
Oh yeah, I'm sorry.
There's two
that I know. Pardon me.
That do movies, and as Mr. Stevens related to the community theater, I would consider that a theater on Lopez, and there's the Orcas Center on Orcas and the San Juan Theater that's here in San Juan, and then there's also the Oddfellows Hall, and I'm sure Granges, etc., which you could consider being theaters. And some of these facilities can hold 300 people. And so I want to be really careful if we're not thinking this all the way through. And again, if the answer is no, the answer is no. But is there not a safe way to allow 25 or 50 people into a theater that holds 300 people?
There may well be, and I apologize for not appreciating how many theaters there were, because I was unaware that there were so many. I was just aware of the more commercial venues. And like I say, I think that the 50% number is what I don't think is safe. It is likely possible to identify I'm sure it's possible to identify a smaller number. The critical piece being that the duration of exposure is quite long, and the getting in and out of the rows is a challenge. But it's not that they can't be overcome, but I think we need a more detailed and data-driven effort to do that. I think it's possible, and I think we can do it. I think that the stage 3 recommendation, 50%, is not workable. So does that make sense?
Yes, thank you very much, Dr. James, for your comments and thoughts. And again, thank you for all the hard work you're doing, and I appreciate your work.
Thank you.
Thank you. Any other questions from the board?
Yes, John Guyman here. Can anyone hear me?
Yes,
yeah, we can hear you, John.
Yeah. Well, I'd like to hear a little more discussion, Frank, around the face mask requirement and how we can make that happen. I'm especially worried about what we hear about at the ferry terminal, and so how can we protect everyone on the island from the behavior of off-island people and visitors from way back? And how can we protect a local business who has people coming in and refusing to wear face masks? And is there any role for the sheriff's office here or not?
Well, there's definitely a role for the sheriff's office. So when people misbehave in a business, that's a problem that's happened many times in the past, and most business operators know what to do. You do call the sheriff, and he does assist you. And in this case, somebody coming in without a mask, that is, they should be asked to leave. If they won't leave, then and is necessary, then the sheriff can be called. And I've been reassured that he will respond to that.
Good.
So I think that is kind of a trespass like any other trespass, if you will. You can require things of people to enter your business, and that's one of the things you can, and here in our county, are required to do. I think that most businesses have found it easy to adopt this rule that we have, because basically it protects them and all their staff and the other people in the store. It's a very reasonable thing to do. It also, they can blame it on me, which is fine. They can say the health officer says you got to do this. And so I think we've made it as easy as we possibly can to do that. We've put additional burdens on those businesses too. The ones that provide food or medicine have to accommodate those people that are unable to come in. It also makes it difficult for some people, and we've tried to seek accommodation for people that really can't, for some reason, wear a mask. There are a few that really can't, and increasingly there's innovation in the business world. There are now face shields that have a combined cloth fitting around them that are basically a mask face shield combination that I think have great promise. Where facial cues are important for people. They were first developed for people that had to read lips to understand others. But I think there's a role for it in education and other places, this kind of modified face shield mask combination. I think we do need to do a better job of educating people, particularly that are coming here. And those are the two provisions on my recommendation, are to make sure that's part of the advertising as much as we can, and also to have some additional kind of boots on the ground presence to facilitate that and answer questions about it, and make sure that people know that our rules are slightly different and a little more restrictive than the states. And now we've given away, Ellen said 14,000. I believe it's 14,900 in some. It's almost 15,000. It's almost a mask for every person in this county. And in places like Lopez, they're all over the place. They're free, and they're kind of cool. They're really well done. Every island has made a significant effort to in and of it themselves, through the initiative of individuals and groups, have made masks readily available. We need to now make sure that culture that we've developed here, that acceptance, that gets conveyed to the people that are visiting, whether they're friends and relatives coming to stay in our home, or whether they're tourists from New York City. But we need to do everything we can to make sure that happens, and those specific additional things that I added outside of the kind of the choice list on phase 2 that were provided by the state, that I think are significant enough to rise to the level of calling them out specifically in the recommendations I make to you today.
Great answer, Frank. Thank you.
This is Dale. I noticed at the ferry terminal in Anacortes, the neon sign announced that face masks are required in the San Juans. Has there been any attempt to get face masks available at the terminal through some of the vendors, if they sell them, or free face masks that people could pick up there that don't know what the requirements are?
I think people are told pretty clearly what the requirement is, and I think there is a problem with accessing masks for people who don't have them, even though it's a pretty low bar. And I think now with the state coming on the requirement, everybody's going to have one. It's going to be a choice to use it or not. I mean, I carry 4 or 5 around in my briefcase all the time. I think the state coming on with their support of what we're doing by having a statewide law is going to mean that most people are going to have these. Now, there are going to be people that are difficult and want to be difficult, and they may need an encounter with the sheriff. They certainly are going to have an encounter with an unhappy shopkeeper that doesn't want them there. And so we have to make sure that people know and understand why that's important. I mean, what we did over in Nooksack is we have a public relations campaign that has young people wearing masks, and it's got a picture of, they're holding a picture basically of who they wear that mask for. It's their grandmother. It's their parent. It's somebody they value in the community. We need to make sure that's the message that gets out. You know, many people think that they're protecting themselves with a mask, and that's not the case. Face coverings protect other people you're around from you giving it to them. And because there's a large pre-symptomatic and asymptomatic carriage and spread of this disease, we have to do that for this to work. For us to be safe, for us to continue to make economic progress, we have to do that. It's a requirement. It's a biological requirement. It's not a legal requirement. It's a biological requirement. It's not just a good idea. It's a law of biology that we have to follow.
Sure.
This is Noel here. I have a couple points. Actually, I have a point I'd like to make and then a question for Frank. And thank you, everybody, for your feedback and input. And Dr. James, thank you for being so thoughtful and your consideration and how you're directing your thought processes and making decisions. I'd like to sort of capitalize on the face mask thing and some of the conversation around that, and perhaps suggest an amendment to the recommendations that includes specifically addressing the youth in our community. What I'm witnessing is the teenagers are not wearing masks, and it's a big concern of mine moving forward, that somehow reaching out to the age groups that are generally not feeling pressured to do so, to wear the masks and practice the standards that society's established as safe practice, and somehow get to the youth. I don't know how that works, but I think there hasn't been much energy put into it, and I see a lot of complacency in our community. The other piece is, Dr. James, we've heard a lot of conversation and sort of emphasis on how we're opening up and how moving forward. I would just like to hear your points for those who are really concerned about their own safety and health regarding how nimble you are, how nimble we are at changing course if we need to ratchet things back quickly, and what sort of trigger points that looks like. I know Mark Tompkins has shared some of the data that we're watching very carefully, but that doesn't necessarily translate to using that data to immediately, effectively change course for the safety of everybody.
Well, to answer the second point first, it's really sustained community spread that we're afraid of. We've done I gotta brag on our staff. Ellen and her team and Steph and Nancy and those guys. What they've allowed us to do is identify very quickly cases through our asymptomatic testing and our other testing. We and symptom management and all of our providers being sharp and on top of it. We've been able to, every single case, identify these people quickly, accurately, and isolate the ill and quarantine the exposed. That has led to really no spread beyond these primary settings. So we've had a mom and daughter acquire from each other. We've had a husband and wife acquire from each other. We've had it in those household units. We've had spread, but it's been limited to that. We've had no community spread at all. And that's why we do what we do. And as long as we can keep it to that, we can control this disease. It's really when we get community spread, and that's going to be how we know to step back from where we're at and go the other direction. When we begin to get cases that occur at the same time and we can't find any link between, that's a really bad sign. So I think we know what that trigger is for going the opposite direction. And it's not just another case. I think we can control these cases. So that's my answer: is when sustained community spread is the red flag where we think about moving backward in these phases to safer positions, move to positions of greater safety. With respect to youth, the county's got a great program that we run through the health department to communicate about drugs and tobacco and other things with kids, where we have youth leadership. I would strongly encourage us to think about, is there some way to keep those programs going during the summer and activating those same youth that have proven highly effective in finding messages that are effective amongst their peers. I would strongly recommend that. I think that, in addition, I think, kids, any of us that are parents know that kids don't do what you tell them, they do what you do. And so by modeling this behavior is the best way to get kids to do it. And the high school, college age kids, they're tough. They are going around without masks, and we need to get them to not do that. They need to know they can get the disease, not know they have it, and kill grandma. I'd turn to Brendan and ask him what public relations effort can we do to get that be more effective. So I think I would turn to our PIO, who's a very gifted fella, talk about messaging that, to think about reaching back to the youth themselves to see if they can help us with this, because they've been very effective in tobacco and alcohol and drug issues in communicating to their peers effectively.
Thank you.
So, Dr. James, this is Watson again. So I'm going to trying to get clarity on the transient accommodations. Does the 24-hour rule apply to moorage and campgrounds?
John Kane, can I ask you again to clarify that for us?
Sorry to be picky, but
No, that's fine. No, that's appropriate. Now's the time to ask that question, and now's the time for me to ask the lawyer.
Exactly.
If you wouldn't mind, give me a moment to pull that up and reread it. My recollection is it has to do with cleaning guest rooms. So I think in terms of a moorage slip, it would not apply because it's not relevant. And in terms of camping, I think it would depend if there's something to clean or not. If their tent is being rented, it would apply to that, but it doesn't apply to the dirt.
Website.
Yeah, I think that's the right answer. I'm just rereading it now to double check. If you give me just a moment.
Okay.
Hey, Dale, this is Rick Hughes. I just wanted to, you mentioned the ferries. I will pass along to ferries your request, and if we have extra capacity, I will figure out how they plan to offer masks to people coming into the county.
Great. Thanks, Rick. While John is looking that up, one of the things Dr. James brought up is whether or not we want to act on these recommendations today, or would we rather review them with some time to come up with some of the questions that Jamie raised about the capacities, et cetera, and then bring this up for another special meeting in the near future. So I ask that of the board to consider as we proceed with what action we want to take today.
Mr. Chair, this is Jamie.
Yes, Jamie.
I suggest, since we have been trying to get to some form of this for several weeks now, that we do move forward, and we have a council meeting that's in recess right now, that we do move forward with these, and that we work on just what Councilmember Hughes was talking about, and Noel, and I brought up the other point, but like I said after Dr. James explained it, that could always be changed through an order or the Board of Health altering it. But I think this makes a lot of progress, and we could come up with something for those larger venues that would make sense. Because I think that would need more discussion with both the venues and Dr. James.
And Chair,
thank you,
Mr. Stevens.
John, have you come up with the answer?
I have. Thank you for coming back to me. I just want to confirm that, yes, the requirement is that the rooms be left vacant for 24 hours before the cleaning. So that applies only to rooms themselves. It doesn't apply to a mortgage slip. I would argue that it does apply to a tent if the tent's being cleaned, but it wouldn't. Yeah, I think that answers the question.
Great. Thank you, John.
You're welcome.
Thank you.
And,
any other questions?
Dr. Dale,
yes.
Dr. Dale, I'm sorry. I agree. I think that the right thing to do is to move forward underneath Dr. James's recommendations, work on several of the other areas that we've discussed today, monitor the situation. I mean, the key here is that we got to monitor our, the progress, and then if we need to make changes, we make changes rapidly. But be very vigilant as to watching the data and as Dr. James pointed out, making sure we're not getting serious or even community spread, and then we can always tweak the restrictions, whether it's lodging capacity or whether it's restaurant capacity or whether it's movie theaters or pools and gyms. I mean, so that would be my
Thank you,
my
Bill.
position.
All right, thank you very much. Well, if there are no other questions, we can proceed with a motion relative to Dr. James' recommendation. Are we ready to proceed with a motion?
Yes.
I'll be willing to do it if you want, Dale.
Okay, please do, Jamie.
I move that the Board of Health approve a resolution recommending San Juan County move to Phase 3 of the State Safe Start Washington Plan, including the health officer's recommendations.
Second.
Any further discussion?
I have a comment. This is Noel. I do have I do want to add one little caveat. I was looking at, and I just haven't heard it referenced yet, but in terms of as we continue to carefully scrutinize our steps and watch what's happening and base decisions on data, I would like us to contemplate that the San Juan Islands Visitors Study from 2018 indicates specifically some traveler data that maybe we can anchor to so that we're watching. So if some of these other counties, say in the Seattle greater area, which is where 50 or 40% of our travelers come from of the 2018 study, that if they see some significant problems, that we use that as part of our decision-making process and how we handle this moving forward, so that we're actually, if there's a potential to get ahead of something, I think we always need to keep that in our sights. That's what I wanted to say.
All right. Good thought. Thank you, Noel. Any other discussion?
Yeah. So Jamie, was your motion was to go to a modified Phase 3, correct?
Right. That's what in the resolution, the draft resolution that was provided, it references the recommendation of the health officer, but I just added that part to make sure it was there.
Right. Okay.
Mr. Chair, this is John Kane. May I make a suggestion?
Yes.
I have you have a draft resolution all in front of you, and I've made some changes to that to reflect the health officer's recommendation today, and also what I understand Mr. Stevens' motion to be. I wonder if you would like me to either describe it or share my screen with you so that the Board of Health could consider, in particular the maker of the motion, could consider this draft resolution to see if it's consistent with what you're wanting.
Why don't you share your screen?
Okay, will do.
Excuse me. This is Dale. Some of us don't have access to the video through Skype, so that won't help us in looking at your recommendations. I'd like to hear it as well.
Okay. I'd be happy to do both.
Okay. Go ahead.
So if you can see the screen, I've highlighted the changes that I've made. So I changed the last whereas clause to indicate that the health officer recommends the partial implementation of phase 3 modifications with changes regarding restaurants, taverns, non-religious gatherings, and theaters. And I want to just clarify for a moment for the board, the way that the governor has structured his plan. He calls phase 1, 2, 3, and 4, he calls each phase a modification of the phase that came before it. So technically, if the county moves to phase 3, the county is implementing the phase 3 modifications. So what I've written in a new section 1 is that the board supports the health officer's recommendation and requests a move to partially implement phase 3 of the Safe Start plan. And then there are 4 sections. The first topic is gatherings, non-religious. Those are the words from the governor's plan, by the way, non-religious gatherings. And it says, allow gatherings with no more than 50 people outdoors. Indoor gatherings remain limited to no more than 5 people outside your household per week. The next section is restaurants, taverns. It says allow at less than 75% capacity with table size no larger than 5 and no bar area seating. Seating shall place people at least 6 feet apart. Letter C, theaters may not open. And letter D says the remaining phase 3 modifications shall be fully implemented as described in the Safe Start plan. I haven't made any other changes to the this draft.
Okay.
Thank you.
Does anybody have any questions of John?
I've just got one, John. So things like the gyms at 50% and the libraries, that's part of what's already allowed under phase 3. Is that what you're?
Exactly. So implementing the phase 3 modifications would mean opening up gyms, museums, not theaters, libraries, and so on. So there's no need to describe that here.
So your recommendation is we use yours.
That's my recommendation too.
Well, I don't think you have a different draft. You could change this and just say you support the health officer's recommendation, period. I'm hoping that this makes it a little more clear for you to understand what the to convey to the governor's office exactly what you want the governor to implement.
So I have a question about the process here. If we do that, can we pass Jamie's motion and then amend it according to the changes you recommend, John?
This is Frank. In my view, what John has clarified my intention in his document. I don't think he's changed it.
How about this, Dale? As the maker of the motion, I would like to withdraw that motion and make another motion to approve the resolution as modified by John Kane and presented to the Board of Health.
Second.
Is there any objection to that from the Board of Health?
No.
No.
Sounds fine.
Can you state then the new motion, Jamie, again?
Okay, hold on just a second.
Sorry.
No, it's okay. I just have to change screens. So I recommend that the Board of Health approve a resolution recommending San Juan County move to phase 3 of the Safe Start Washington plan as modified by John Kane.
And I second. This is Rick.
Okay. Any further Discussion.
This is Dr. James. John, could I ask just for a clarification? I believe that I don't think we'd wanted to say that that people of a single household are not allowed to sit closer than 6 feet from each other. Can you clarify that? Because currently we do allow people, if they already live together, to be closer than that distance, whether it's outside or inside.
And Dr. James, I think you're referring to the restaurants. That was the same question I had. So the tables need to be 6 feet apart, not necessarily people at the table.
Right, it's the table, and then even within that, if the people all come from one household where they live together, I have interpreted that we can allow more than 5 to sit at a table. Do we need to specify that level of detail, John?
Yes, it should. If the maker of the motion wants to clarify the section, I would recommend. Well, a couple of things come to mind. First, it may be difficult for restaurants to implement a seating arrangement where the restaurant needs to ask each of the people, are you all from the same household or not? So I think that's a practical difficulty. It would be simpler for the restaurant to implement something where the tables are arranged such that people from each table are at least 6 feet apart.
Well, John, I think the actual regulation is the tables be 6 feet apart, not the people. I mean, correct me if I'm wrong.
Mr. Stevens, can I make a friendly amendment to your motion? I mean, can I at least offer it up?
Go ahead.
Sure, I had unmute.
Oh, sorry. So I move that we modify letter B under section 1 to say seating shall place tables at least 6 feet apart.
That would be fine with me.
So that's included in the motion then.
Yep.
All right. Did we resolve that issue? Are we ready to pursue a vote? Are there any other comments?
So, Mr. Chair,
yes.
Not to be a process hound, but I think someone would need to second my amendment and then take a vote on it and then vote on the whole thing.
All right. Is there a second to Rick's amendment?
Second.
I'll second it.
All right. And I would like to, so the motion and the amendment is up for a vote. There's no further discussion. I'd like to call the roll for yes or no from the Board of Health members, okay?
Yep.
So, Guyman.
Aye.
Yea or nay?
John Guyman, aye.
No.
Aye.
Kyle.
I'm sorry, Mr. Chair. This is just on Rick's modification. Is that correct?
Well, I thought we included that in the original motion. So thank you for bringing that up. Do you want to do just the amendment and then the whole Jamie's motion? We can.
I think that's the process that Rick just described. So we got that second, and we're voting on the amended motion.
Got it. My bad. So we're voting on the amendment. John? Guyman?
Aye.
Noel?
Aye.
Kyle?
Aye.
Watson?
Aye. Watson.
Jamie Stevens?
Aye.
Rick Hughes?
Aye.
The ayes have it. The amendment passes. I vote yes. Now to the original motion that Jamie made. It was Is made and seconded.
For you, Dr. Heisinger.
What's that?
I can read it for you, Dr. Heisinger.
Please do.
Moved by Mr. Stevens, seconded by Mr. Hughes, to approve a resolution recommending San Juan County move to Phase 3 of the Safe Start Washington plan as modified by John Kane.
Great, and that was seconded. Again, we'll do roll call vote. John Guyman?
Aye.
Noel?
Aye.
Kyle Davies?
Opposed.
Bill Watson?
Watson, aye.
Jamie Stevens?
Aye.
Rick Hughes?
Aye.
So the motion to move on to Phase 3 is passed. 6 in favor, 1 in opposition. Thank you, everybody, for this very important decision that we've made in moving forward. Were there any other issues relative to this the board wishes to address?
Dale, this
Dale,
this is Mark. So just for the board, I will, once John sends that to me, signed, I will prepare it and send it out for signatures like I did last time. And so be on the lookout for that. It'll be set up with the Adobe Acrobat for your signature to sign, and then it moves on to the next individual. So be looking for that in your inboxes later today.
Great. Thank you, Mark. Kyle, your environmental health fee, we had a late fee waiver request.
Chair, this is Noel real quick. I'm sorry, I have to go. I'm late for another appointment.
Thank you for staying as long as you did, Noel.
Okay, and thank you, everybody. It's a tough process, and I appreciate everybody's input. Thank you.
Kyle Dodd, do you have a request?
Thank you, Chair. Thank you for making time to consider a Group B water system annual operating permit late fee, and I'm going to ask you if you're able to provide direction moving forward as we go to mail out the late fee notices for Group B water systems. So you have in front of you, with the packet, the specific water system that returned their annual operating permit application in late without the late fee, and they had requested a waiver based on the circumstance that they had an unsatisfactory water sample and had to resample. As I indicated in my staff report, I am preparing to send out the second notices this week. 24 of the 191 active Group B water systems have not returned their application and will be getting that second notice. As it stands right now, they would be receiving a late fee in addition to getting that notice as part of that process. However, in my recommendation below, I am recommending that the Board of Health waive late fees for 2020, given the fact that we are under rather uncertain times with the COVID-19 outbreak and the widespread impacts that it's caused. As part of my recommendation, I want to provide some context and some transparency with respect to the annual food service permits renewals that were processed in February and March. I need to let the board know that I made a decision outside of the normal process of having the board review and approve late fees associated with those permits based on the circumstances that we mailed those late fee notices on March 9th. There were 10 food service facilities that still had not paid the annual permit fee. 1 week later, on March 16th, Governor Inslee announced the emergency proclamation mandating a 2-week closure of all restaurants and bars. Right around that time, Governor Inslee required the waiving of late fees and shutoffs for utilities. So given the fact that we were in the middle of responding to the outbreak, all in emergency response, and we had canceled the Board of Health meeting, also taking into consideration the board's history in reviewing late fees, I felt that the late fees in the context of businesses being closed and unable to generate income were not reasonable, and I made that decision moving forward for those 10. So I wanted to be transparent and fill the board in on my actions around the food service lates, and have you consider that as part of my recommendation for the Group B water systems as well. So my request and recommendation, the recommendation today would be to waive the late fee for this specific water system, and I would ask for clarity how you want me to proceed with the 24 water system applications that I would be mailing renewals for in the coming week. So try to make that as clear as possible. Let me know if there are questions or if I can answer anything else related to that.
Questions from the board?
If there's no questions, Mr. Chair, I'm ready to make a motion.
So Kyle, this is Councilman Watson. So Kyle, did the 10 food licenses ultimately all get submitted?
They did get submitted. So I specifically sent an email to all of them, letting them know that the decision did not affect the normal renewal fee, that they should submit that minus the late fee, and all of them did. So that's where we ended up there.
Okay, thank you.
Any other questions? Do I hear a motion for the Group E water system first?
Mr. Chairman, I move that the Board of Health waive the late fee on the RESC fee water system, as well as any remaining late fees for 2020.
Is there a second?
Second, Jamie.
Further discussion? Those in favor say aye.
Aye.
I'm sorry. Was there someone going to raise a question?
Yeah, I'm sorry. So this is Watson. I'm still presuming, though, that they need to get their reports and testing accomplished. Correct, Kyle?
That's exactly right. So this isn't going to affect the renewal application and their water sample results. We are still going to hold them to that. This is specifically around the late fees that are assessed when returning those applications after the due date.
Okay. Thank you.
Any other discussion? Those in favor of the motion say aye.
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 Opposed? The food service. Kyle, did you recommend that we have a motion supporting what you have done?
No, Chair. I'm not prepared for that. You guys can certainly discuss that. That was me being transparent with the actions I took in the context of my recommendation today. So
All right.
those decisions have been made.
All right.
Off
Thank
with
you,
his
Kyle.
head.
Thank you very much. Any other questions? It was very fruitful meeting today, very, very difficult. I want to thank Frank James for an incredible report and passion in dealing with the issues that we have, and I thank the Board of Health for the difficult decisions as we move forward. The staff at the Health and Community Services have done an outstanding job that hopefully allows me to have some confidence that we can proceed without having catastrophic results. Stay tuned for that. Do I hear a motion for adjournment?
So moved.
Second.
Second. Those in favor say aye.
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 Thank you very much.
Thank you, Dr. Dale.
Good job.
All right. Thank you, Board of Health and Chair Heisinger. The Board of Health meeting has been adjourned. We are now reconvening the San Juan County Council meeting for Wednesday, June 24th, 2020. So, Mr. Stevens and Mr. Watson, do you need a break or do you want to power through this?
Let's keep going.
Keep going.
All right, so our next item is a discussion and action to consider recommendations from the Board of Health and the Health Officer. I have one quick comment or request for change on the ordinance, or the resolution, excuse me. On the last, where it says now therefore be it resolved by the Board of Health, I think that should read San Juan County Council.
Mr. Chair, this is John Kane. Do you mind if I make a comment?
Sure.
I've updated the this draft resolution to reflect what the action that the Board of Health just took. Would it be helpful for me to share my screen and also show the change that you've just requested?
Yes, please.
All right, one moment. I've made minimal changes. They're highlighted here. The first is in the second to last whereas, where it indicates that the Board of Health's resolution was to move to phase 3 with partial implementation of phase 3 modifications. I corrected the typo in the resolution portion to read County Council. And then in section 1, I reworded it to simply say that the County Council approves the Board of Health plan to move to partial implementation of phase 3 of the Safe Start plan. In my view, there's no need for you to recount precisely what the Board of Health plan is because it's necessary for you to forward the Board of Health resolution along with this resolution and the application. So that's what we have. Happy to make any other changes you'd like to see.
Thank you, Mr. Kane. Just to expedite this process, Council, if it's all right, I'll just go to each of you to see if you have any questions or comments regarding the Board of Health or this document. Can I start with Mr. Watson, please?
No comments.
Thank you very much, Mr. Watson. Mr. Stevens?
No comments at this time. I guess the only comment is I think we should go with John's modifications. And I think it should be understood that that's what we're going to vote on.
Great.
If that's okay with Bill also.
So, yeah, and, if John could show us the title of the resolution, then we can read that in the motion.
Great. And I concur as well. One more thing I'd like to, since there's timeliness to getting this signed, once we have something that's on the record for approval, would either one of you, are you both okay with using a digital signature? Assuming we approve this?
Yeah, it won't Mark be sending it around like he will to the Board of Health?
Yes.
Yeah, okay. Great. Just wanted to confirm. All right, I have no questions either and do support as well the changes made by the Deputy PA. I would entertain a motion for approval if that is a desire of council.
Mr. Chair, Watson moves to approve a resolution approving submittal of an application to move to phase 3 of the Safe Start Washington plan as modified today by Deputy PA John Kane.
Second.
We have a motion and a second to approve a resolution submittal of an application to move to phase 3 of the Safe Start Washington plan as modified by Deputy PA John Kane. Any questions?
I had a comment if I can do a quick one.
Of course, any question or comment, excuse me.
I just think we've done a lot today and we've had some really good discussion. And I appreciate all the comments, both for going to phase 3 or reasons why we shouldn't. But this virus is going to be with us for a long time. And as such, we have to learn how to live with it in the world. And we'll have to be vigilant in personal responsibility to protect ourselves and to prevent the spread. And we know what those are. That's wearing a mask, social distancing, and frequent hand washing. And when I say personal responsibility, I also put that on to businesses. We have made changes in the past, both at businesses and personally, to accommodate other health issues, such as the no shirt, no shoes, no service. I think, especially now that the governor has made it a law to wear a mask, it shouldn't be hard to say no mask, no service, and prevent some of those ugly encounters. And as far as personally, more people wear, I had never worn a bicycle helmet until about 10 years ago, and now I wear a helmet. It's odd to go on my bike and forget it. So I think we can adapt to have good preventative and protective measures. Thank you, Mr. Chair.
Thank you, Mr. Stevens. Mr. Watson, would you like to make a comment at this point?
Yeah, so I think Mr. Stevens said it well. I mean, this really now comes down to personal responsibility. I mean, it's sort of always been there. This isn't an issue of the Department of Health. This isn't an issue of the hospitals or our doctors. This is really about personal responsibility, making sure that everyone is protecting not only themselves, but our community at large. And so it's going to take a consistent and unified effort by everyone. We can't, point fingers at others. All we can do is be responsible for ourselves. And I'm sure as we pull together on this, then, we'll be able to move forward. The economy will get restarted. The health of our citizens will be protected. And as Mr. Stevens said, this isn't going away in a month. This is, we're entering into a new normal, and unfortunately, we're having to define what that new normal is as we're entering it. So, people just need to wake up to that fact and accept that tomorrow is going to be different than today or yesterday. So, I think this resolution is doing it. I think easing into phase 3 is the right thing to do. But as I stated at the Board of Health meeting, we need to monitor, and we need to monitor to make sure that, we're staying on top of what's the impact of the actions that we're taking today. So thank you.
Great. Thank you both very much. I wanted to make a quick comment. One of the public comments earlier said that council approved the advertising message. We did the first one, which asked people to not visit us. I do not recall council taking a vote or endorsing or directly supporting the new advertising that's come out. I just wanted to state that. I agree with both Mr. Watson and Mr. Stevens. Thank you for saying that. I want to reiterate what I said in the Board of Health meeting, that my hat's off and thanks to Ellen and her staff, and Mark and Brendan and Dr. James and Kyle and Mike Thomas for the work they're doing, emphasizing again that wearing a mask is a really important thing for us to move forward, but I also think we need to preserve our island culture and be islanders. So we need to move forward and be good neighbors and be good friends and not get angry or treat other people differently, even if they may not be doing what they're supposed to be doing. If there's an issue with masks, then please contact law enforcement. Thank you. At this point, anything else? All those in favor? Oh, sorry.
That agrees with you.
All those in favor say aye.
Aye.
Opposed? Motion carries 3-0. Thank you very much. One more discussion item. Dr. James had mentioned in his original order about the advertising messaging about wearing masks. Do we want to talk about that briefly today or wait and put it on the agenda for Tuesday?
I think it's pretty clear. So anybody doing advertising will have to update their advertising to include that messaging.
John Kane, are you still on the phone?
Yep.
Yes, I am.
Is that in the order to require the advertising messaging?
No, it's not.
What do you mean it's not?
It was a suggestion from Dr. James. It's not in the resolution. That is
That's correct.
John?
Yes.
This is Jamie. According to our resolution, it's the resolution the Board of Health passed also references the recommendations of the health officer. And in that, it says, I recommend the following additional requirements.
Yes.
So it seems like that is part of the program.
So let me clarify here. When the county moves from one phase to another, the only choices that the county has in transmitting something to the state to move from one phase to another are to implement all the things that the governor says or to implement some of them. So the idea of adding conditions for advertising is not a phasing modification, or is not a phasing step that can be implemented or not implemented. So doing something different about advertising has to happen outside of the move between phases. It would be a separate action by the county.
But isn't this an example of we can be more restrictive, just not less?
Yes.
So then why can't it just be a part of our program?
Because what the phasing does is move us forward or backward in the governor's plan, and the governor's plan doesn't have anything to do with advertising.
All right, so it has to be a separate health order or an action by the council.
That's correct.
Hold on a second, Council. Mr. Kane, can I ask you a process question?
Sure.
So I'm reading the discussion action item that we have on our agenda, which says consider recommendations from Board of Health and Health Officer. It does not clearly suggest which things we need to do. So I'm thinking we could pass a motion right now supporting the advertising if council's agreed with that. Is that correct?
Yeah, I agree with that.
All right, so I would entertain a motion today on the advertising portion that was suggested by Dr. James, or we could move it to next week.
What do you want to do, Bill?
Well, I'm reading his recommendation here, and I'm trying to figure out how to do that. I think we need to outreach to the other organizations. I mean, what's the definition of county-supported advertising? I
think that would mainly be the Visitors Bureau, wouldn't it?
That would be the only thing that we at least contribute funds to. Now, that doesn't mean the Visitor Bureau can do non-county supported advertising, right? i.e. they can do their own advertising.
I would also say the Chamber of Commerce as well.
And one might include the Chamber of Commerce in there, yep. Because we contribute funds to them. So I think it's worthwhile actually that we need to reach out to the 4 organizations and discuss this with them. I mean, maybe we don't need to take an action other than to reach out to them, and if they all agree to do this, then that's the action, right?
If we move that way, I think we could each contact our own chambers, and as the LTAC person, I could contact the Visitors Bureau or somebody else.
Yeah, that would be good. So I think my suggestion is let's reach out to the 4 organizations, and then if we need to actually like pass something, then we could maybe do that on Tuesday.
Is it, if it's, let me make sure I understand this. Is it all right from council, for council, that I add to Dr. James's 2 bullet points, plus there was a third request for him about educational personnel, or maybe that's the second one.
Yeah, that's the second one.
In regards to, let's just put that a third one in regards to ferries as 3 bullet points for discussion on Tuesday.
Yep.
Is that all right, Jamie?
Yeah.
All right.
And someone needs to talk with Dr. Dale of the Board of Health, right? Because the educational thing was really towards the Board of Health, and how did the county council support that effort by the Board of Health?
I'll be happy to talk to Dr. Heisinger in that regard.
Thanks, Mark.
And then, Rick, if you have a moment, I just want to kind of let the council know where we're at with the application.
So, Mark, just before you get started, if you wouldn't mind just announcing your name and position for the record.
Sure. Are you ready?
Yes, sir.
So, okay, thank you. This is Mark Tompkins, Director of San Juan County Health and Community Services. With the, I think you've already adopted the resolution, correct? You voted? Yes. You have directed us to complete the application. I know John has indicated what remains is more clerical and data reporting. It's quite extensive. And so we are in the midst of that. We're going to do our best to process that as quick as possible. I can't guarantee that we will be able to complete the application today. We will be working to route those resolutions for electronic signatures as soon as possible, and we will complete the application as quick as we can, but it may not be as quick as last time. So I just wanted the council to understand that, and anybody else listening. We'll be working as fast as we can, but it is much more extensive than the prior application and requires a significant amount of work to pull data and other items to fully and accurately answer all of the requirements in order to have a successful application. So I just wanted the board to understand that, and council understand that.
Great, thank you.
Thank you.
One more thing for council. Brendan, are you on the phone?
I am.
When we went to phase 2 from phase 1, interestingly enough, there was complaints from business owners that they weren't aware that this was happening when it came, because it turned around so fast over the weekend. Is it possible to put out a press release as soon as possible that would mention there is a possibility of us moving to this modified phase 3 at any point?
Yeah, draft with that is actually with John Kane now for review based on the results of this morning's discussion.
Okay, again, I want to emphasize that at any point in time after today, we could move into phase 3 pending the state's involvement.
Correct. Thank you.
Thank you. Thank you, Brendan.
Is there any other questions for staff, or do we have any other discussions we'd like to follow up with or have at this point?
Well, since Brendan was just on, I just wanted to make sure he agreed that his email to us was a public release of information.
That is correct.
All right. So my problem was when you hide the to list, I don't know whether that's internal confidential or whether it's external public information. So I couldn't tell since you hide, the to list.
Yeah, fair enough. Yeah, in general, and there might be exceptions to this, but in general, when I share a media release with council, it is either already gone to the media or will be going to them shortly.
Right. All right. And then, Ellen dodged it completely, and I'm going, wait a minute. So is it or is it not public?
Yeah, and I think, you picked up on very astutely and rapidly I don't know what the word is, but a slight divergence in policy and approach between traditional public health way of doing things and then the expediency and practical realities of what we're trying to accomplish today. And we were all in contact ahead of time, and we were both trying to tiptoe through that as carefully and thoughtfully as possible.
Right. Well, my conclusion was that Dr. James and Ellen, who were involved in the testing process, could not comment on the testing results, whereas you as a public information officer could discuss the broad subject since you weren't actually involved in it. But
that's a fair statement. I won't disagree with that.
Mr. Watson, if it's all right for the public, do you mind if I read the section from the press release regarding to case 17, which is, I think, what you're alluding to?
Well, it's fine with me. Right. The press release has gone out, so.
Right. No, I'm just going to read this to the public for the record really quickly. Case 17. A resident of the Village at the Harbor, a senior living community in Friday Harbor. The county health team coordinated the testing of 61 individuals, including all staff and residents of the facility and a small number of other close contacts. All tests came back negative. I'm going to repeat this. All tests came back negative, including a retest of the initial positive individual. At this time, it is not clear if the original positive was a rare false positive or if there was some other complication with the lab analysis. Regardless, ongoing testing will help ensure that there is, in fact, no current infection in the facility.
Right. And thank you, Brendan, for getting that out quickly, because I thought it was important to get it out, and because I know that's where a lot of people's concerns and questions were, and especially since we couldn't trace it to any source.
Yeah, no, exactly. You and I are on the same page on that, 100%.
Right.
Brendan, can I ask you a process question on that case? So if in fact that case 17 was a false positive, or does that still count against our case count?
I would say that I've already tiptoed into the public health realm close to my limit this morning, and I would leave that to a Mark, Kyle, Ellen, or Frank question, if that makes sense.
Good
How'd
dodge.
I do? Was that delicate?
Yeah, good dodge, Brendan. Appreciate that.
A lot of dancing going on this morning.
Yeah. Rick, the answer to your question, it was a positive. The initial test was positive. As far as any follow-up, we'd have to work with the state health department and the state health officer on any subsequent tests and a determination whether it was a confirmed positive or not. So again, tiptoeing around it, more work to be done, and we'll let you know what the results of that is.
Right, and again, I don't want to cause extra work, but because of the fact of the location of this positive case, it becomes an outbreak, and I think it's important for us to clarify in some level that there isn't an outbreak in the county or at that facility.
Yeah, we will continue to work with the facility and the state health department on any appropriate follow-up that needs to be done in trying to ascertain the discrepancies between the two tests that were completed on the individual.
Great, thank you, Mark. And Mark, I wanted to pass along to you, thank you as well for all of the hard work you and Kyle and Brendan and everyone, as we've mentioned throughout the process, but I haven't personally thanked you for the effort you're putting in to move us through the phases. It is an incredibly large task, and I really appreciate the dedication and response time that you and John Kane and the rest of the team is doing to get us and our community moving forward in a safe and manageable way. So thank you.
Thanks, Rick. Appreciate that. And as always, we can't do it without a team, and it includes the council as well. And your allowance to have us bring on temporary on-call staff to assist us. So it takes the entire group from the top to the bottom to make all this work. So thank everybody, and thank the community for adhering to so many of the correct things to really prevent illness in our community.
Great, thank you very much. Council Ingrid has something for us.
Yes, we've received some questions on the public regarding wearing masks outdoors when we're, in groups outdoors. And the question is, to be clear, is everyone to wear a mask outside on the streets in public areas?
Mr. Tompkins or Mr. Kane, what is the order?
The way I have read the order from the state is that if you are outdoors and you cannot maintain a 6-foot separation from others, then you are to wear a mask. If you can maintain a 6-foot separation, you do not have to wear a mask outdoors.
And clarification for that 6 feet separation outside of your family unit.
Correct. So if you're out hiking in the woods with your family, you don't need to wear a mask. If you are approached by other groups and you're going to be closer than 6 feet, then in that case, you're supposed to have masks on.
Excellent. Thank you very much. And Council, is there any other comments or questions?
Not for me. Thanks for all the work.
Great. And one more reminder, just to remember, because we haven't done this in a while. Monday we have a meeting focused on the budget here at 9 o'clock. Just wanted to give you a heads up and reminder. And thank you for your time today, Council.
Thank you.
Meeting adjourned at 11:53. This concludes our joint meeting. Thank you very much from the public and from staff and Council and Board of Health. Have a great day. Thank you.